So for anybody just joining us, we apologize. We were just a couple minutes late due to some technical difficulties, but we are here now. So um, very, very excited for this meeting. We've had a couple in the past that have been just great. We've had a lot of good feedback about them. So we got in touch and decided we should do some more. I'm here joined with Dr. Dasa and Jessica Richmond. They're both wonderful, wonderful people doing wonderful work, and I'm so happy to talk to them more about the work they do. Today we were going to talk about understanding your childhood and how that relates to your romantic relationships. I'm assuming also even just interpersonal relationships as well, and how things like your attachment style, the way you were mothered as a child, is going to have an influence on this. So very, very honored. I appreciate both of your time very much. They're both in India, so this is on the other side of the world. So we had to do some little bit of figuring out which time would work best. And so I know it's in the evening there for you both, and I appreciate you spending your evenings with us here. I'll go ahead and introduce, this is Dr. Dasa, and Dr. Dasa is a Gaudiya Vaishnava scholar and practitioner. And in addition to that, he's also the director of the Jiva Institute of Vedic Studies. And this is a wonderful institution that does a lot of broad range of work on different things. And I will share some notes at the end so you can look more into the work that they are doing there. And in addition to that, he's also has written books, written translations, commentaries on many different subjects in Indian sciences. If you look at the website, you'll see it's just quite extensive and renowned, the work that Dr. Das is doing. So I'm sure all of that accumulated wisdom is going to come through in this talk as well. So we'll be covering some very specific topics, but every time we end up talking, there's always a great amount of things that all seem to kind of rise up from that too. So thank you, Dr. Dasa. Hare Krishna. Very happy to have you here. And we're also joined by Jessica Richmond, who is a psychotherapist, Western trained psychotherapist, who's currently living in India and studying directly with Dr. Dasa. And she's also doing the work of combining both these Western sciences of therapy with the Vedic view. And I just find this absolutely fascinating and so needed. You know, particularly being here in the West, it seems we have a little bit of a limited kind of idea of which tools we can use, and the Vedic system seems to just shed so much light on ways that we can continue to do this work at a deeper level. So very happy to have you here as well too, and very grateful for your time. And they both teach workshops around the world, obviously with COVID in the last year and things like that, that's been a little bit halted, but they're doing some online activities, and so we'll definitely get into some of that. And I always have people interested in getting in touch and learning how they can work more with you, so we'll talk some more about that too. But with that being said, let's get into talking about this very, very interesting subject with how our childhoods affect our love relationships in life. And I know you both will have many, many tools we can use to navigate these waters and also kind of understand how we get to where we are. Anything you'd like to add before we start? I have many, many questions, and I'm sure some other people might too. But
no, it's fine.
Okay, great. So maybe you could start with giving me a little bit of background on where does this come from? Where does this idea of how we are mothered spring from? I know in the notes I was looking through, you say that the role of the mother is maybe 1,000 times even more important than the role of the father, and how we become who we are. Can you say more about that?
Yeah, so of course, there are many books in Indian or Hindu culture, and one of them is called Manu Samhita. Manu is, according to our belief, is the first man. In fact, the word man comes from Manu. So we call him as the first man. Of course, his wife is also there, Satarupa. And he wrote a book called Manu Samhita, which was written a few thousand years ago. Of course, there are renditions of it. And in that, he actually talks about life, how we should live it, how the parenting should be done, how the education of the child should be done. After marriage, how should husband and wife live, and so on. Many principles he gives. And he gives this concept that a child imbibes a lot from the mother. So just to give you an example, that when you want to grow something, even if you want to grow some flowers in your backyard, so there are two things involved in that. One is the seed, other is the land. And combined together, they give the product in the form of a plant or tree and the fruits and flowers that come out of it. So the ground is compared to the mother. And that's why in India we also call sometimes earth as Mother Earth. And the seed is like the father. So father is that who implants the seed into the womb of the would-be child. But all the care and the growth and nourishment of the child is done by the mother within the womb for about 10 months. And then when the baby is born, then she feeds her own milk and takes care. Father is there, but the main role is the role of the mother. Therefore, Manu says that Matu Pita Sahasrena Gaurvena Tirichate Garbhapasham Dharana Poshabhyam Sati Vartate. Says that mother is 1000 times more important, influential, or carries the effect on the child, because she is the one who keeps the baby in the womb, and then after the child is born, she is the one who nourishes the baby. So baby is not being nourished only by the food or by the breast milk, but the baby is also learning. Even in the womb of the mother, the baby gets influenced by the emotions of the mother. And they have now scientific proof of this. In Indian scripture, there are many stories of this. Mahabharata, which is a great epic and greatest epic of the world, carries 100,000 verses in it. It actually has few stories which indirectly tell us this, how when the child was in the womb of the mother, got influenced by what the mother was doing or what mother was eating. So mother's moods, emotions, the food which she eats, this all has an influence on the baby. And if the emotions are negative, then she's also feeding the baby with that. And if she's eating something which is not healthy, then that is also influencing the baby. So if the mother is stressed during the pregnancy, then the stress also imprinted on the brain of the child. And then when the baby is born, then baby is very observant. I'm sure everybody has noticed that the baby may be lying in the cradle, but is always looking around and very attentively. Even if the baby does not understand the language of the parents, but baby understands emotions. And we may think that, child, what does child know? It's not true. So how the parents are dealing with each other, or how is the mood of the mother, it all has influence on that. And the biggest influence on the child is how the mother relates with the baby. Whether the mother is attuned with the baby to the needs of the baby or not attuned. Whether she is taking care or she is negligent of the baby. And about this, there's a Harvard professor, he did actually a lot of research on this. It's well known that how if the child is not taken care of, the mother is not attuned to the needs of the baby, then baby develops, abnormal personality. And this becomes, when the child grows, this becomes the mode of operation, how the grown-up person may not trust the others, have problems in romantic relations or even relations in general, at work, wherever. So therefore it is very much stressed in Indian culture, the role of mother. and how she has to bring up the child. So traditionally, there were joint families all over the world. In India, we still have that. And this is to make sure that baby is secure. Baby does not feel neglected, lonely, no one taking care. But now this is one big problem in the society, that maybe both parents are working. So naturally, mother has to not just take care of the baby, but also do her job. So she actually has a big load and stress, and baby suffers because of that. Because you can keep a nurse or maid servant or whoever, but she is not same as the mother. The emotions, the feeling of love which mother can give, they are irreplaceable. And this is a major nourishment for the psyche of the baby. We may give our attention to the food, the nutrition and the diet for the child, and a lot of things available for that. But as far as emotional diet is concerned, there's no replacement for that. You cannot go to a supermarket and a mall and buy some emotional diet. There is no love diet available there. So that primarily comes from the mother. And therefore, it is a very important role that mother has in the bringing up of the child and shaping up of the personality of the child. So this is what our scriptures speak. So we have the idea from that, and then of course there's a lot of research which has been done in the modern psychology. They have different types of attachments, different types of parenting styles. They have studied it, and they have done very detailed study how it influences the psyche of the child and how the child behaves later on depending on the type of parenting which has been done to her.
Fascinating. It makes me think of, in the Ayurvedic texts, they have whole books dedicated to embryology and even month by month how the mother should care for herself to take care of the baby who's in gestation, and how that can affect the baby both physiologically as well as you were saying, mentally, emotionally, spiritually, right? So it almost lays a blueprint in a way for how that person is going to go through life that has such a major, major role. So
Yeah, because you see, our society ultimately comes from a woman. It's not father only, as I said, gives the seed, but then the real product is developed by the mother. So whether male, female, or any other, gender, it all comes from the mother.
mm,
And the whole society is made, what we call as a society, as a aggregation of human beings. They all come from there, and therefore she is the one who is shaping it. And not just the body, but most important is the psyche, the mind. And if that becomes distorted, then there are problems in the society, which you see in a lot of drug abuse or crime, or exploitation, or depression. People are some 13 to 15% of the population in the US is depressed. So what is the root cause of that? This is main reason is the upbringing. So that's why Manu rightly said that it is 1,000 times more important. He was right.
I had a person commented and said, it was a woman who I know, she's a mother, and she said, "No pressure, ha ha ha," in relation to being 1,000 times more important. Which of course then leads me to the question though, so what role does the father play? Is that more of just a supportive role in shaping that? Is that, I guess if it's 1,000 times more for the mother, what role does the father play?
Father's role is also important, because the main role of the father is to give discipline.
Mm.
Because mother by nature is very loving, kind, soft. And father is more strict, the male figure. And therefore, his function is now to bring discipline into the life of the child and to inculcate values for the life, to prepare the child so that child can come out in the society. Because when you are small, you are at home and your world is just the home basically. Mostly the child is dealing with mother and father, primarily with mother, and then there may be siblings and grandparents and other. But then he has or she has to, or they have to come out of this. And then they come in the society, they go to the school and work. And so how the person is going to behave outside is very much different how you behave in the home. Because home you may have a very loving and kind family members. Outside is a different scene. So then it is the role of the father to prepare child for that. That what kind of values and how you have to deal with the different kind of people, and the character and the work ethics. So these things father is supposed to do that, which is also important. But the base is coming from the mother.
Okay.
So you want to say something? Jessica.
I would say that from working with my clients, the reason why we even got this idea to start talking about this, and we just completed a retreat on this topic, was because at the core of all the issues that I see is this very thing of the mother not attuning to the child in the first few years of their life. So that's such an important piece. And attuning, what I focus on is attuning to the child's emotions. There are some mothers who are actually great, like they provided everything the child needed physically. They had the cutest outfits, they got to go to special classes, and they had everything they needed, like materially, but the mother wasn't able to acknowledge their emotions, to validate their feelings. The mother kind of treated them almost like an object that needed to have, all nice, cute things and get to do fun things. But so this is such a missing piece, I think, and it's not the mother's fault. I mean, the mother who acts like that, her mother didn't attune to her, So she's just passing it down. But that's the piece that is missing over and over again, that makes the person as an adult feel unloved, unworthy of love, not seen, not validated. And either that person ends up becoming afraid of relationships because they think that someone's going to hurt them again, like mom did, or they become very needy and desperate relationships, still trying to get that validation from mom that they never got. So I think the father piece is really important too, especially with disciplining the child. I see a lot of people who might have had the mother attuned to them, but then the father didn't do his role. He was more like aloof, or maybe he had a drinking problem, or maybe he wasn't there at all. If the father's not invested in the child with not only discipline, but being like proud of the child, being like, you've got this, I'm so proud of you, you did such a good job, that combination of discipline, but being engaged and being like, making the child feel confident in their abilities in the world, then those kind of people as adults don't, there's a block. They can't get where they want professionally. Right. Because the father didn't believe in them, so they don't ever go for it. They kind of are stunted professionally. Where if the mother wasn't there attuned to them, they're stunted emotionally. They can't engage. It's really scary for them to be in a relationship that's emotionally intimate. So that's kind of like...
It seems that we develop these based on how we were mothered. We sort of we hardwire our brains in a way to almost for survival, right? Because we need our mothers because, on a very physical level, they're the ones who give us the food and a roof over our head. And so that wiring becomes a survival mechanism in a way, right? But as we move into adulthood, we don't drop some of these patterns. Is that an accurate way to say it? And so we keep kind of playing out this same dynamic, trying to find love or trying to find acceptance or nurturance, or right?
It's because very early in your childhood you learn how to cope with the situation. So if the mother was not there, she was not attuned to your needs, to your emotions, or if father was not validating you or supporting you, or if you did not feel secure in your relationship, So then what happens that everybody, whether child or grown up, we want to feel secure, we want to feel loved, we want to express ourselves freely without any inhibition. And this is only possible when there is somebody with whom we can confide without any fear that, somebody is going to get upset, angry, freak out. So when we have that confidence, then we can do that. But if that was not available from the parents, then we still need that, or either we suppress it or we find some mechanism. We may become angry and throw tantrums so that we get attention, or we may just fall sick because we feel that when I'm sick, everybody seems to pay attention to me. Different ways. Or you just hide in a corner, or you become depressed, or you think I'm not worthy of love. So then this becomes your personality. You don't know this. There's no question of that we don't drop it. We can drop it if we know about it and we know that it is not something good. So as a child, because child is very vulnerable and does not have much power physically or mentally, so whatever she does to survive, to operate in life, then she thinks that this is the way I have to operate when I grow up. But when I grow up, I actually have more power now. And these things are not functional anymore in the society. They're dysfunctional. They make me dysfunctional. But I don't know that. I don't know any other way to cope up with situation. So I still keep on using the same things which I had before. Just like if you have a toy cycle as a child, and then you grow up and you think that I still have to use my toy cycle and not that I actually have a normal cycle which I can, bicycle which I can ride and go at a faster speed. Suppose I don't know that. So I'm still trying to go with that small wheel, and big guy, I'm sitting on that. How long will you go?
And then when people try to point it out to you, people say, oh, you're on this doesn't work for you anymore. You freak out and say, you get mad at the other person because you can't see.
Because you said it always worked for me. What are you saying?
You get mad at the other person. So that's why Babaji is saying it's very hard to see that your attachment style is causing you trouble. You think it's the other person who doesn't love you, or who's being mean to you, or who's avoiding you, or something.
Because we are convinced about our coping skills, our mode of operation, our way of life. We are convinced about it because it worked. So now how can we give up?
Right.
And try something else which is unknown to me.
So the first step, I would think, and you can correct me if I'm wrong, is we need to recognize how we were mothered, right? We have to see what happened and what is the pattern that was laid for me, or what pattern did I take on? And I've read your notes. I've seen that you break it down into a couple different mothering styles, right? And then each of those styles will have an effect on the individual and how they operate in the world. So would that be the first step? Would you say we need to figure out how we were mothered? Bless you.
Excuse me. Yes. So that is the important thing. And just like you mentioned Ayurveda. So how does Ayurveda function? That if I have a problem, then first Ayurveda tries to find out what is the problem and what has caused it. So they always try to go to the root problem. Which doshas are imbalanced and what is that which caused it? It doesn't have to be something gross. It could be something coming from the mind. So similarly, the first thing we have to figure out is that how was I raised? Because that's where my programming was done. As you said, hardwiring of my brain. So it was done in my childhood. And that's the way I look at things. You see, if I am myopic, then I read things which are close to me, and things which are far away, I cannot read them. But I don't know this. If you are born with a proper vision and you grow up and then your eyesight becomes weak, you don't realize it because it happens gradually. So you may be sitting in a class or you may be watching things and your vision is blurred, but you think this is normal. Unless things become that you cannot read and other people are reading, then you compare and say, how is that I cannot read? But that doesn't happen in our life. So some kind of distorted upbringing has given me a distorted vision of life. And I don't know that. Because in this particular case, usually my eyesight was good and then it became bad. So there was a change. But here from the very beginning, it is distorted vision. So unless someone else tells you and you get convinced by it, you think this is normal.
Right.
Because how do other people know that you have an eyesight problem?
Right.
You do not know it. And you don't know it. So you continue and you think this is the normal way of life. This is how things appear. But only when you put on your glasses and you say, oh my God, things look much clearer now. I can read better, I can see better.
Right.
But unless you come to that point, you think that you're normal. So if somebody tries to point out to you that you have this problem, you are actually having a problem with having a relationship, you don't accept it.
Which
You
is
always,
what's so lovely about the work that you all do, because part of that, right, is you have to find somebody you trust enough to look at you and
right.
and and trust their vision of what they can see, because you only have a small little scope of who you are, and since that's how you grew up, you think that's very normal and healthy, and it's the rest of the world that's got it wrong, right? So I think what's so beautiful about your work is that you've developed these systems to look at these things and look at a person and see how were you mothered, and break it down even into a few primary mothering styles, and then you can use that system to sort of say, these are the results that will come from that in an unhealthy way or a healthy way, and then how do you want to correct and change that? Would that be a good way to put it?
Yeah, that's a good way, because as we said that everything has a cause behind it. You see, our whole life is based on cause and effect relationship. So what you are now, there's a cause behind it. There's so many factors which have made you what you are at present. It's not random. It has not just happened like that. So if I'm sick now, then there's something which happened behind, back in time, right? Which made me sick. So then I have to find out that if I want to be healthy.
Mm.
So same thing works with mind. It's nothing different. Only thing is that mind is something which is invisible. It's not, physical body, you can do all kinds of tests. Of course, now with brain also you can do MRI, this, that. But things like emotions and moods, they are very difficult to catch. What is love? It's not something that you can put somebody inside a machine and figure out if this guy has a living heart or.
A blood test for that, right?
If somebody who is a criminal person, he's going through airport, they have a security check. But can they check what is inside the mind? The real problem is here. He may not have any weapons or anything which is dangerous, but he may have a dangerous idea inside. 9/11 was done like that. These guys did not come from outside carrying some weapons. They just took the plane and made that as a weapon. So the real problem, the real weapon was lying in their brain, and that no machine can test. So that's why psychotherapy is such a difficult job. First you try to figure out where is the problem, and when you talk to the person is not going to tell you, I have this problem, I have that problem. You have to question and question and question and try to figure out. In fact, they will resist it because everybody thinks my parents were great, because you only have one set of parents. Of course, if you get divorced, the parents get divorced and you have another. But I'm talking about the birth parents. So they bring you up, and that's you consider they're great. You cannot see their flaws because you don't have that much intelligence. The discriminatory faculty is not developed yet in childhood. So you grow up with this whole idea, although they may have some deficiencies, they did not take care of you, but you don't know this. So if psychotherapists try to get into that area, it's a very sensitive process.
And we're very good at hiding those things, right? That we don't want to be seen.
So if you have a physical ailment, you go to a doctor, you don't resist so much that I don't have a fever. If you have a fever, doctor says you have fever. If you have ulcer, you have ulcer. Okay, I accept. But if doctor says, no, you have this, psychotherapist says, no, you have this problem. Even if you say you're depressed, no, I'm not depressed. So immediately resist. So it's a very tough job, especially if you are trying to make the client educated about the problem. And Vedic psychology works like that. Vedic psychology is not just treating the patient, but it actually educates the patient. Because patient has to participate in the process. And that participation happens by understanding. So that's a difficult job.
Yeah, so I wonder, there almost seems to be, since as we become adults and we can't go back in time and do that over and have our mother change, and she probably wouldn't. So we need to remother ourselves in a way. Would that be accurate? We need to figure out how to understand what happened, understand the way we were mothered and how that affected us, and then how do we move forward? How do we remother ourselves at that point?
Yeah, that's a very good question, because obviously you cannot undo something which has been done, but you can influence it, you can try to fix it. And I think Jessica will speak more on that because she actually does it.
Jessie, save us. How do we do this?
So what I would say first is this is very difficult work because number one, you have to trust the therapist. And the very problem that you have makes you not trust the therapist, right? Because if you have a secure attachment style, then as an adult, you're going to trust people. If you have an insecure attachment style, which is why you're coming to therapy, automatically you're not going to trust the therapist. You're going to project your attachment style onto the therapist. Either you're going to be anxious and you're going to think the therapist rejected me, the therapist doesn't love me. All that stuff is going to get projected right onto the therapist. Or you're going to be avoidant. So when the therapist tries to be emotionally intimate with you and tries to ask questions where you'd open and share your emotion, you're going to do things to push them away. Or you're going to be this disorganized attachment style. You know, it's this push-pull. You come close and push away. You might open and share something and then you do something to push them away. Maybe all of a sudden you stop going to therapy and you don't even give any reason why. You just stop booking appointments, you know. Or you come to therapy and you talk about something not even related to what we're talking about for the whole hour. Or you know what I mean? Or you start talking to you start blaming the therapist for something that she did. So these are all ways that you're putting your childhood attachment style onto the therapist. So it's really hard to get to that place where you can actually trust anybody when you have this style. So that's a lot of the work I do, is trying to even just build some sort of relationship first. Because we can't just go right into your insecure attachment style because you don't trust me, because you didn't trust your mom, you know? So that's the first step, is just starting to build some sort of relationship, because if you can start trusting your therapist, that's how you learn how to start trusting yourself. And that's how you can learn, okay, this therapist is showing up for me no matter what kind of behavior I'm doing. They keep showing up, and they keep, you know, making healthy boundaries and a safe place for me to express myself. And eventually you can get the hang of that, you know, this therapist is not going to hurt you. Then you might start, okay, maybe I'll open a little, you know, because the therapist's job is also to educate you and say, okay, you know, this is this attachment style coming up. Can you see it? And sometimes you can't. You know, I've had some clients who really can't, even if I say in advance, you're going to project this stuff on me when we do this work, you know, they'll still like just drop out of therapy or create some story that I've hurt them somehow or something like that. But it's because actually they had a very bad attachment to their mother, and they don't see that I'm not their mother. You know, that's a transference that happens. So I'm just mentioning that because I don't want to make this seem like, oh, it's so easy. Let's just mother ourselves and we'll just teach you and then we're good. This is like one of the biggest stumbling blocks of therapy. How do you get to that place when your very problem is you don't trust somebody, but you have to trust them to do this work, you know? So that's the first kind of important piece. And then to do the work, you have to nurture your inner child, the part of you that's hurt, that's emotionally hurt. It literally could be from age 1 month old when your mother stopped breastfeeding you. It might not even be something you remember. You know, it may be something very, very subtle, like maybe your mom had postpartum depression. You know, she loved you like crazy, but she had postpartum depression, so she couldn't attune to you. You know, or, you know, I know there's a big controversy about, you know, should you let your kid cry it out or not? And it's very strong. People think on either side of that. So maybe your mom let you cry it out. That's a big samskara. You're crying, that's the only way you can express yourself. And if your mom can't come, what message does that send you as a child? That can create an insecure attachment. You know, so there's all these different ways that it can come, and we have to kind of try to figure out the way, and then we have to nurture your inner child by accessing your inner child and talking to her or him and saying the things and even doing the things that they needed to hear or feel or experience. Even though right now you might be 40 years old and that happened when you were 1 or 2 years old, we go back to that place because the emotions and the memories that were stored, they don't age. So just say it happened when you were 2 and your body's 40, that's still fresh and ripe at age 2. That memory and those feelings did not, you know, people say like, oh, time heals all wounds and, you know, just let it pass. All that means is time concealing the wound. You're just covering up with your personality and other defense mechanisms to not ever look at that again. But if you're working in therapy and you hit that nerve and all of a sudden you start crying like a baby because you hit the actual memory with all the feelings that are unprocessed and undigested. So our goal with the inner child work is to get to that place of that memory, of that painful time, and nurture that little boy or that little girl who didn't get what they needed from their mom.
It's beautiful. And so that cannot be a long process, I would imagine, and could take anywhere from couple months to couple years, and maybe even longer, depending on where we were raised and the environment we were raised. So there's different kinds of mothering styles, right? There's a neglectful parenting, there's authoritarian parenting, there's permissive parenting, and authoritative parenting. Is that right? Mm-hmm. And so each of these styles will give you certain good things and bad things, right? And since we all have these, we all have some work to do, right? I like how you said, you know, even sometimes the mother, maybe it wasn't like they were a terrible parent. It's just because we're humans and we're flawed, and we're not always so conscious and aware of what would be the best way to parent a child, right?
Right, like Babaji and I were always talking about, we should have like a parenting school and a parenting certificate, you know, so we could teach. We're saying we should have a school where we teach, here's how to attune to your child. Let's practice, you know, because why do we assume that we know that? We shouldn't assume that we know that. That's a skill.
So previously, when there were joint families, then it was better in that sense that they learned from their grandparents. So the grandparents were there and they have experienced it. So they will pass on their knowledge to them. But now we have what they call as nuclear families. There's only husband and wife or partners, and there's no one else. You know? And they don't know anything about parenting. They have not seen it. When they were children, they learned it, but they were not consciously educated how to raise children. They picked up things the way I was treated by my mother, so I may pick up something from that. It just goes in my consciousness. But I have not been taught how I should treat a child as a parent. So this was possible when people live together in joint families, but that's not the reality at present. So that's why there is a need for education, that we should learn that how the child has to be taken care of, what are the needs of the child, and what things influence her psyche. And just as we know about physical body, they need some this vitamin, this mineral, iron, whatever. Like that, the emotional nourishment, that should also be taught.
And experienced. We have to experience it ourselves, actually. We have to do our own inner child work before you can take care of your baby. Otherwise, you're just operating from your old way. In other words, you don't go to parenting school and just learn, okay, I have an insecure attachment style, but never mind that. Let me just learn intellectually how to do it for my kid. A lot of people want to do that. They'll come to our workshop and we're teaching about it and they're saying, oh, I'm totally thinking about how I can do this for my kids. And it's like, okay, that's step 2. Step 1 is you got to make yourself securely attached. Otherwise, you're just a machine. You're not doing it from your heart. You're just memorizing steps. Okay, I'm supposed to do this for my kid. I did it. Okay, are we securely attached? Instead of like, oh, I have this really insecure attachment style and I really have to do that deep work on myself before I can even think about trying to do that for somebody else. So all of the things that we teach are very hands-on and applying to yourself first.
Right. I love that.
So parents may not have done good job, and it's not their fault because they were also not trained. So if I don't know and I'm doing something, I'm not doing it with bad intention.
Right.
It's just that that's my knowledge system. So they were also trained like that in their childhood by their parents.
Mm-hmm.
And then it just gets passed on. So it just goes on, and so we cannot also blame parents for it. They didn't do it knowingly, that they actually know how to do parenting, but they don't care for it. No, they don't know.
Yeah, that's another very important point, because what happens is when we teach this, then sometimes people get mad at their parents. And then they try to educate their parents. You know what? See, when you're doing this, that is very bad. That's insecure. That makes me feel insecure. That's why I'm like this. That's why I can't get a good partner. And it's like, this is your internal work. This is stuff that we're teaching you to work on yourself, not to now as an adult blame your parents or educate them or try to get them to change. That very often happens, one of those things. Either you're pissed at them and you need to have a talk with them and explain what they did wrong and how it hurt you, you know, or like you're going to try to teach them how to be a better mother or father now. It's like, no, they are who they are. They did what they did. They may be in therapy on their own. That's their choice, but it's not your job now to make them a better parent. It's your job to parent yourself now. You're an adult. You can learn the skills, and that's what the mothering is.
And if you become a parent, then do a good job. Because what your parents did, they already did.
Yeah, it's done.
That can't revert that.
Yeah, and actually, they didn't know what you need. That's why they didn't give it to you, and they don't know what you need. You know what's missing, especially through therapy. You can find the holes, the places that really hurt. You know your holes, and so instead of trying to go and get your partner to fill the hole, which we usually do, or drugs or alcohol, or some other distraction, or your parents, someone else to fill the hole, or something else. Instead of that, we can fill the hole ourselves if we're willing to roll up our sleeves and look at it, you know, with the help of a guide and do the painful work. It's the only way, actually. There's no other thing that's going to fill it, even though we try. That's where a lot of like overeating comes from. We're trying to fill that hole of emptiness and loneliness and being unseen.
So it sounds like even trying to educate your parent about what they did wrong is also trying to fill that hole instead of filling the hole yourself, right? If you can put the blame on your parent, then you don't have to actually do any work. You can just say, see, you messed up. That's why I'm bad and I don't have to change, right?
Exactly. And that happens a lot.
It's easy to point finger at others,
Right.
but to bring a real change within yourself, that's a hard work.
So then this how we were parented or how we were mothered specifically, then will transfer into our adult romantic relationships. So how do we look at, you know, say somebody was raised in a insecure environment, they tend to, insecurely attached person will tend to, tell me if I'm wrong, please, but it seems they'll gravitate towards avoidant personality. So there's always this magnetism between unhealthy people of different styles. Is it better to find somebody the same style as you, or are you looking for a securely attached person? How do you play that game? How do you make that work, or can it work?
Well, you know, whatever is your experience in your childhood, and that's what gets imprinted in your heart. And then you are naturally attracted to somebody which matches with that. So if you have anxious type of attachment style, then you want somebody with whom you can latch onto and grab that person. So you naturally gravitate towards that person. It is not so much that that you consciously think like that. It's just that your psyche works like that. If there are 20 people sitting, then you will naturally will become attracted to that person.
The confident type who doesn't care about you, that type.
Yeah. So there's some kind of
Josh, he's like, oh no.
It's some kind of hidden chemistry, like magnets. How one magnet, North Pole and South Pole, they attract each other. But where is the force of attraction? You don't see that. If you put them together, that force is there, but you don't see the force. So exactly like that, you naturally lean towards such a person, and you'll spot that person.
I mean, it blows my mind, Dr. Dasa. It just feels like, yeah, our brains, it's almost like who's in control here? Because our brains start firing the hormones and we get all goo eyes and you're like, this person. And so often they're probably the exact wrong person, right? Yeah. Like people seem to do that pattern over and over, and you'll be attracted to the person. It's probably the worst partner you could possibly have in the long run, for longevity of a relationship. And it's almost like our minds have tricked the physiology to fire those chemicals and the dopamine and things like that, right? It's who's in control here.
Person would appear very attractive and very special to you. No one else sees the speciality in that person, only you see it. That person looks like is the only one in the whole planet. This is the one I want. So it's very interesting how the same person looks so beautiful, attractive, magnetic to you, and to other person it just looks like a very ordinary person, and they wonder why is he so much, running after this guy. What is so special about it? The speciality, as they say that the beauty lies in the eyes of the beholder.
Right.
So it is that beauty coming from inside because of the construct of the heart. So they exaggerate that particular characteristic in that person.
And if we haven't healed our inner child, then we're going to be seeking that same type of bad, I shouldn't say bad, but the parenting that didn't actually help us, because we're still trying to heal that bond and do that work, even if it's subconsciously, right? So, but we're picking partners that aren't going to give us our actual needs.
It's like a blueprint, As a little kid, imagine you have a blueprint and you're like, okay, this is love. It looks like this, right? And so then you're going around, you're in a room of the 20 people, and all of a sudden it's like, that blueprint matches exactly. Oh, that person's ignoring me. They're like laughing with other people, but with me, they're ignoring me. I try to smile, they don't smile back. Perfect. Yes, that's an unattuned person to me. That matches my blueprint.
Crazy.
So this is very interesting phenomenon. That's why you see many times people come together, they get married, live together, then they separate, and then they again find similar person. If they don't get educated, they keep on finding just exactly a similar match.
Mm-hmm.
I've never done that, Dr. Dasa. I have no idea what you're talking about.
You're right.
Yes, it's almost like it's different body, same person, right?
Same blueprint.
Different. Right.
Yeah. They can be totally different with what they're interested in and how they are with you, but they give you the same feeling. You know what I mean? Like you could be with somebody who's a workaholic the first time, your first marriage, and you're like, that's it. I am never going to be with a workaholic again. So the next person you meet is a stay-at-home mom. And you're like, awesome. See, I didn't get the workaholic. But that stay-at-home mom is like totally self-absorbed and not interested in you. The same way the workaholic was absorbed at the work.
Maybe just watching TV or playing video games.
Yeah.
Something.
So what are the characteristics or what are the pillars of a securely attached relationship? How do we do we find this, or does this mean both people have done this work, or do securely attached people exist in and of themselves? They must, right? What do we do? What do we do here?
Well, these days not many people are there with secure attachment.
But they think they are. That's the thing.
Right.
Most people think they're securely attached. This is the hard part.
So securely attached people are those who are actually very much grounded in themselves. Like in insecure attachment, as Jessica was saying, there is a feeling of emptiness, loneliness, and you're trying to fill up the hole. A person who has a secure attachment is not like that.
But sometimes grounded in yourself looks avoidant.
So you're very grounded in yourself and peaceful, and you are not always reacting to the situation, but you are proactive. So this takes a lot of work. If somebody is coming from a family like that, that is another thing. Otherwise, it needs a lot of work to come to that situation. But it is worth it, because there is nothing like it. There is no replacement for this state of mind. Otherwise, you can have anything externally. This is what people are trying to do. They're trying to get all kinds of things, surround themselves with various types of gadgets, house, boyfriend, girlfriend, cars, whatever, 2 homes, summer home, all that. But inside, they're not satisfied. I know many people like that. They have wealth, they have position, name, fame, everything, but inside they're not happy.
Right.
But there's one insecure attachment style called avoidant, and that person looks like they're grounded in themselves because they don't want a relationship. They're afraid of it. So the other two types really want it, they want it, but this type, the avoidant type, looks like, wow, like they haven't had a partner in years, they're really good at their job, they travel around the world, they have friends, they seem that's a secure person, so you can get tricked. That's not a secure person. That's a person who's avoidant of intimate relations, especially expressing feelings, holding the space for you to express yours, and then them sharing theirs. They may be in a relationship, but they're not emotionally available. But they seem grounded in themselves, but really they're just aloof, cold, and distant emotionally. So that those types will say, I'm secure in myself. And the two other insecure types will be like, oh, that person is totally secure in himself or herself, but it's actually an insecure attachment style.
Like a lot of masks, right?
Yeah.
It's kind of a mask. What's underneath?
Somebody who's securely attached, they're able to be emotionally intimate. That means if you talk about your feelings, they can hear them, and if they talk about theirs, you can hear them.
So what would you say are some just kind of simple steps? I know I want to talk about this in a minute too, how people can work with you, but are there any kind of just very simple things that people might be able to do in their day-to-day relationship, even if they are in a relationship or not in a relationship, that they could ask themselves, or how can people be more conscious or aware of what's happening for them in a given situation to determine if they're acting out of their mothering, or if they're acting from like a balanced place? Is there any just simple tools that you guys like to use for people?
Sometimes it's too difficult to figure out your mothering style or your attachment style. The simplest thing to do first is get in touch with your feelings. So oftentimes we recommend doing eye gazing with yourself every morning for 1 minute. If you're brushing your teeth, after that, just 1 minute in the mirror and gaze into your eyes and try to access your feelings and then validate them. Like, just say you have a really big day ahead of you, but you're so worked up over the day, you haven't actually taken just that 1 minute to realize, I'm nervous. I have got a big interview today, but we might not even notice this. But so in the interview, we're sweating, we're like talking too fast, we're stumbling over our words. But just if we took that 1 minute in the morning and literally all you do is say, how are you feeling? And you look in your eyes and try to access your heart and then validate it. So just say, oh my God, I didn't realize it. I feel nervous. And then say, of course you feel nervous. You have a big interview today. You're not sure if you're going to get that job or not. You're not sure if they're going to like you or not. You're not sure how you're going to do. So of course you're nervous, you know, but you've got this. So you kind of parent yourself just in that moment. That's a very good practice. Instead of getting too much in your head, like, okay, what's my attachment style? And now what's her style? And then what's my partner's style? I think that's too much in the head on your own. It can just throw you off and stress you out more. Instead of just doing this very simple practice of getting in touch with your feelings and honoring them. I don't mean by acting on them, because sometimes people say, oh, I honor my feelings, so I'm angry, so I lashed out. Honoring them like, of course you're feeling like that, but once you nurture that feeling, just for that, in that 1 minute, it cools down. And then you can go about your day.
I love
What do
that.
you think?
Yeah, it's good.
It's beautiful.
It's
Simple.
doesn't require any big education or tool.
Yeah.
Right.
Everybody likes to look at their face. Just look at your eyes.
Yeah.
Hard.
I think people do. When I say do the eye gazing, then after I'll say, did you do the eye gazing? And they'll say, oh my God, I look so old. My wrinkles, I look worn out. And I'll say, we're looking beyond your skin. Literally look into your eyes as deeply as you can, you know, to access your heart. Not about your, you know, what's wrong with you. It's about your feelings, and those can't be wrong.
I love that you give that piece too about the validation, because I think it's easy for all of us to maybe beat ourselves up too much about things, you know, and say, oh, I'm garbage, or I'm no good, or I'm old, or I'm whatever, you know, or I'm broken or something, right? And I think it's beautiful to also remember to validate and love ourselves too in that process, and accept ourselves, and love that. I love that. So I'm being very conscious of time right now, but I do want to ask, so people always end up contacting me and they want to know how to work with you guys. What projects are you working on? I know with COVID, things are a little bit all over the place, but are you doing any sort of online programs right now? Is there a structure for how people can learn how to do this process of figuring out how they were mothered and remothering themselves? What are you guys doing right now?
So we've created just a small, like, brief therapy package, because a lot of people want to get started but they don't know us yet, so we want to just give something little. It's just eight sessions with us, Babaji and I, a few with me alone to get us started, and then with Babaji and I, just for remothering.
That's awesome.
Like a remothering 8-pack, and then you can see from there what tools you can take from that if you need to go deeper into therapy. So it's kind of like a little appetizer teaser pack, because sometimes, you know, that can be enough just to get you started.
Right. Develop the interest and
Yeah. Just to get started into it. Okay. Especially some people are already seeing therapists, you know, so you might, you know, do this little 8 sessions and then take that back into your therapy. And some people will go further with us after that. But because this is such a big theme we're seeing with our current clients, we just created this package.
Okay.
This 8 is for remothering.
Yeah, and I hope that someday you all will be able to travel again and come to the U.S. We had made some brief discussions about possibly having you come to the Southwest of the U.S., so I would love that too. But so if people want to get in touch with you to set up for this package and work with you all, how do they do that?
They can email me. My email is Jess, JESSRICHY 108@gmail.com.
Okay. And I'll put that in the notes as well. And also, I know jiva.org is probably a way to access you, Dr. Dasa, for things that you're doing through the Institute. Is that the best way to reach you to, jiva.org? Is that also good?
My website has all the Vedic psychology. So Dr. Dasa teaches philosophy, which...
My website is more related with philosophy.
Okay.
If you want anything with Vedic psychology, then just approach our website.
Yeah, JessicaRichmondTherapist.com.
Okay.
I also do a lot of work on my own, which is more spiritually oriented, philosophy and all that.
I know, Dr. Dasa. I looked at it this morning again. I've seen it before, and I just went, there's so much there. It's a beautiful website too. So we'll have people contact Jessica through your website, and I love so powerful, such great work to do. And I love that you're combining both these elements of Western psychotherapy with the Vedic system. I think it's just such a beautiful integration, and it's not very common. You know, we see Ayurvedas in the West and you know, Vedic astrology and things like that, but there's not many people doing what you all are doing. So I think it's so powerful, and I'm so grateful for the time you've given today. And it's always fun too. I always enjoy the conversations. So
Thank you, Josh.
Thank you so much.
Thank you for hosting.
okay, Hare Krishna.